So in the previous videos I've shown, I was actually planning an 8mm screw in this patient, but due to the amount of expansion he's going to need, I'm going to try and actually fit a 10mm screw in here. So what that looks like is right now it's just barely impinging on tissue, and so this is a choice you have to make for yourself, whether you're willing to push in another millimeter. That's going to obviously cause some tissue impingement, but if we're okay with numbing the patient for the insertion of the implants, we might just need to numb this area a little bit, activate the screw a little bit earlier, and hope that the patient can tolerate that little bit of impingement. That'll give us an extra 2mm of expansion, which is probably going to be pretty valuable in a case like this. So here's how I do it: is I actually went ahead and went into Blue Sky Plan, and I drag and drop in. Well, I guess I can go ahead and show you what that looks like. I can drag and drop this right in here. This is the 10mm screw. Call it a maxilla, just like we called the last one a maxilla. It's going to try to align. It doesn't really know how to align because it's a three-dimensional object, and it's not. There's nothing to align to. But if we click on Model, right here, this is the alignment panel right here, the model manipulation panel. Click on To Model. I can say, which do I want to align to? Well, I already positioned my 8mm screw earlier. So if I just say, okay, I want to align it to that, it just snaps right into place. Sorry, let me turn this one off. So now you can see that where the red one was, this new one that I just dragged and dropped in there, that teal one, is now right in line with it. So I don't have to do anything else. It's already now in position. So I can see that, okay, here it is. My red one was there, but now I can see, that it's impinging more in this view. If I zoom in here, I can see how much more it impinges. And you just have to decide, are you okay with this? Is the patient able to tolerate it? I'm on the fence here with this patient. I mean, he's got a lot of tissue thickness. Most of us have seen expanders that impinge on tissue after a while. So I think it would probably be okay, but I'm going to have to sit on this one for a little bit. But at least this will show you how to swap it out. We just planned with the 8, and I can quickly bring in the 10 or 12 or whatever, drag and drop it in there, and then just click that button, Align to Model. When you do that, make sure that this box right here is not checked, Align with points. We don't want to use points. We just want to align it right to that one we already positioned. And so now I can come up here, I can say export, and I've already exported everything else. I can just say, well, now I want to export this 10mm one. I click export, which I've already done, and so now I've got that other one in here. I brought this 10mm screw in here, and so now I've got a model that impinges. Now you could just say, okay, send this to your lab and say, okay, I'll go ahead and make this fit. Now they're going to have to grind this model. So I don't really want to make them grind the model. I mean, they can, but then they're gonna have to grind and check, grind and check, grind and check. So we've already ditched out for these teeth, so why not go ahead and digitally grind for this? To do that, there's a few different ways. Honestly, I'm kind of thinking off the cuff here, so this might not be the perfect option. I'm sure I'll think of better options later on, but you can go ahead and I actually think of a couple ways to erase and fill, which is a technique where you delete a section and it fills it in. But I'm just going to use this sculpt tool. I'm going to come up to brushes, and I'm going to go to drag. I'm going to make sure my size is pretty big, and I'm going to go right to the middle of it, and I'm just going to click and drag inward until I can see the flat part start to appear. And once the flat appears, you know that the screw should fit in there. And I'm just kind of doing this all around it. You can't visualize it all that well, but you just kind of have to move the model around. Once you know that it doesn't interfere, you might want to move out the rugae above it a little bit as well, just so you know they can actually slide this in when your lab technician goes to design this. This also gives you an opportunity to see how much impingement this really is. Sometimes in 3 dimensions, it's like on the imaging software, it might look easier than it actually is, but this is going to give you an opportunity to truly see how much space essentially has to be created. Some people might take a burr, like a diamond burr, and actually create the space, and that way it's almost like a pizza burn that should heal back. But I don't think I would do that. I think I would just let it press in there, and then just do it that way. So, all right, looks like we've created the clearance we need, and so now you could export this model as is, and your lab should be able to print the model, set the screw right down on top of these posts, fabricate the wires, the arms to wrap around the crowns, and then the bands, and then it should be good to go. All right, hopefully that little add-on helps you for knowing how to fit in a new larger screw.